welcome to the Nursing Career Transformation Roundtable. And today we were exploring the topic of entrepreneurial opportunities for nurses, a paradigm shift. My guest today is Kevin Ross, RN, BSN, who has become what many would call a serial entrepreneur. He has over 17 years of combined entrepreneurial and managerial experience as a business consultant and mentor, tech evangelist, blogger, podcast producer, and an advocate for just about everything outside the box. His ability to effectively cultivate innovation, optimize brand architecture, and revitalize product and service delivery across multiple categories is a persistent endeavor of his. And Kevin says he is honored to be a nurse for the last 9 years in this field, has continued to challenge him with some of the most complex patient populations, and has proven his proven track record for critical thinking and providing ethical care to all patients is his highest priority. So now I would like you to join me in welcoming Kevin Ross, RN BSN. Hello, Kevin.
Hi, Kate, and hi, everyone. Whether you're viewing live today or on the archive podcast, it is a pleasure and an honor to be here. I am really excited. I'm always really excited, so I'm especially excited to be here with you.
I'm very happy to be here with you as well. I just, before we begin, want to tell everybody your website is innovativenurse.com and rnfmradio.com. And Kevin, you do a lot of podcasting and radio shows, and you have a lot of other entrepreneurial activities. Let's start with the subject of mindset. Don't you think that really the mindset of the entrepreneur is the number one most important thing for success? Because otherwise you just might not have the faith in yourself that you need to have to get up out of bed every day and show up.
Well, I think you actually hit on a really key point here, Kate, and that is faith in yourself. I mean, as the entrepreneurial mindset, I am always talking to business owners and entrepreneurs out there, is that, this is a hustle, and this can be a grind, and it's not going to be easy. But is nursing? I mean, seriously, nursing, it can be rough and tumble a bit. Right. I know there can be some compassion, and I'm not talking about that. It's not all edgy. But I think nurses are wired and well positioned to actually be entrepreneurs. And in that mindset, you do have to have faith in yourself. And I think the majority of, whether it be a failure or just not even getting in the game of entrepreneurship, is because we don't have faith in ourselves. We don't believe enough in ourselves. And quite frankly, you're a nurse. Believe in yourself, because the public out there believes in you.
Well, isn't that the truth? The public believes more in nursing. Nurses have more faith in nurses than they do in doctors or any other healthcare providers. But because we give so much of ourselves, often we have lost our identity and not even knowing who we are because of giving. So instead, I believe we should probably consider very strongly the beauty of not working for anybody else but working for ourselves. So tell us a little bit about your businesses and how the kind of advice you would give nurses as to how they can become entrepreneurial and leave these day jobs behind or night jobs behind or whatever, so that they can live a life of freedom. And not to say that they aren't going to be working hard, but it might. And what do you think the number one thing that nurses might be afraid of? Do you think it might be technology?
Well, I don't think technology would be the number one thing. I do think that nurses can be afraid of the technology. We hear stories about the EMRs and, the computer, and I can't, I'm spending more time on the computer than I am with my patient. So I think technology can be a barrier. But like I said before, I think the nurse themselves are the first barrier. I think we actually put these self-imposed obstacles in front of ourselves. Well, I can't do that because, or, that can't happen because of this or because of this person. And so I think, again, if you have faith in yourself and faith in your skills and your expertise, then that will sort of help you parlay this, taking it from an idea where you're got chicken scratch on the back of a napkin or a piece of notebook paper to kind of executing on that idea. And so when I when I first started my company that is a nurse consulting company, Spire Health Partners, what really was eye-opening to me is I was at the bedside. So I told you earlier, Kate, this was off the air. I worked at Johns Hopkins Hospital in Baltimore, and I loved it. And I'm not kidding. I loved it. And I loved my coworkers, and it was a very cohesive team. But when we saw people in these ICUs, and they literally come in just sick as all get out, just train wrecks, and most of this is preventative, I thought, when we decided to move back from Baltimore or leave Baltimore back to Colorado, that experience taught me, okay, I can deal with these critical situations, but can I actually, I'm a nurse, I teach, I educate, I think I have the skill set to actually help people before they get to that point. So with Spire Health Partners, I started that at my dining room table. So I'm in my home office today because I told you, Kate, that my corporate offices are way too loud and too much hustle and bustle, and people will just kind of barge in. So I'm in the comfort of my home right now with you today. I started my company, Spire Health Partners, in my home at the dining room table, and I decided to provide a service to help advocate, educate, and provide nursing services to clients out there that were in critical need. And I started doing that one thing, and I did it really, really well. And then my company then grew from there, and we just branched out. So I want the listeners and the viewers to know that it is possible for you to take your skill set as a nurse to do some very similar things that you're doing in the hospital. Now I realize you don't have hospital beds and you don't have all this technology and things like that, but we can actually help our patients before they end up in the hospital. And that's what Spire Health Partners started doing just over 7 years ago, and we're still doing it today.
And how did you branch out? You say you branched out. So you started pretty basic, and then you became probably more complex in the services that you offered, would you say?
That's right, Kate. What we did was, so we started with one subset of the population here, and we worked with people with physical disabilities and developmental disabilities. And what my company decided to do was partner with state agencies and regional agencies in the area to provide nurse consulting services, because as we know, folks with developmental disabilities or physical disabilities or have a lot of comorbidities, these individuals can certainly, they're frequenting ERs, they're not taking their meds, they're not basically getting the services that they need. And if they don't, then it fractures the system financially and just the utilization of the resources. So certain states and certain regions have decided we need to have consultants like nurses come in and help bridge these gaps, to help talk to all of these professionals, to help make sure that these clients, these patients are taking their meds, their nutrition is dialed in, they're getting to their doctor's appointments. So we started doing that one thing, and we did it really, really, really well. And we got really successful at it, and I branched out, and I had to hire more consultants, more nurses, and get the team bigger. From that point, we decided, well, we could actually do this on so many other levels. We can branch out into corporate wellness, because as we know, corporations are fractured by the fact that they have absenteeism increasing with their employees because they're stressed out, they're not eating right, they're not sleeping well. And so we were able to bridge those gaps for them. And their investment in our time and our resources was actually a huge return on theirs, because their absenteeism started to drop. Their employees were losing weight, or they were gaining weight for some, and they were feeling healthier. They weren't smoking anymore, or they were taking time out, like 15 minutes, just to kind of take a break,
right,
and then get back to it. So we do child care health consulting. We work with schools and daycare systems. We do one-on-one coaching. We do small groups. And all of this came about is because I always tell people, keep your head on a swivel. You got to learn how to pivot. And my podcast, The Innovative Nurse Show, I just recorded a show about pivoting in your business. If you're doing something really, really well, and it's a service that might be kind of aligned with something else that's going on, then that's what we decided to do. We figured we could actually provide a very similar service and then branch out. And now we serve a lot of people in the state of Colorado.
How many people do you serve?
Well, we serve, I think the number is around, because I'm so elevated in the company, I think it's around 1,600 that we have helped or currently serve, and that would be chronic disabilities, homeless individuals. We hotspot. We get into neighborhoods, and we work with these individuals, but we like the term hotspotting because we can go in and take a whole neighborhood or a whole subset, a cohort, and work with them, and it's infectious, but it's a good infection. We can start that process, and then it just kind of trickles in to the ecosystem of that neighborhood.
It seems like the Ebola virus would be a good way to your company could prevent that quite a bit in
Right.
the services that you deliver.
Well, I mean, even simpler than that, and I want to say simple. I mean, flu kills more people than Ebola does, and so,
Yes.
getting people their vaccines, or just teaching them about proper hygiene and
Right.
nutrition, and covering, coughing into their elbows and things like that. We've actually seen flu cases go down. We actually have proven that our services has probably saved the state millions of dollars in
Isn't that
Medicaid
something?
funding because people aren't going to the emergency rooms anymore.
Yes.
I mean,
Yeah.
they are, but the people that we work with, they're not.
Right. Right. Oh, that's terrific. Congratulations.
Thank you.
Yeah, that's great.
Thank you. Well, and that's an opportunity that nurses can really look at, Kate, is that if you are good at like cardiothoracic, like I worked in cardiothoracic surgical ICU. So do you have some expertise in cardiac rehab? When patients they have their cabbage, so open heart or valve replacement or whatever that is, but then they need to rehab and they're out of work or out of their lives for like months. And so the hospital, they might have some programs where they kind of help you rehab, but I don't think it's as comprehensive or integrative as it should be. And so
Right.
nurses are very well positioned to say, hey, listen here, John Smith, it's likely you might be out of work or out of, sort of your cycle for the next few months. But how about if I actually can decrease that by, how about if I cut that in half? My
Mhm.
involvement will help you, teaching you about nutrition and your medications and kind of keeping you accountable just as sort of a coach and a mentor, like really keeping you accountable because people start feeling good. What do? They revert back to their,
Exactly.
bad vices.
Yeah. How do you handle insurance carriers with that kind of work that you do how do you go out and get that stuff covered?
So, that's a great question, and this is my honest answer, is that with insurance companies, if you get to a point where my company right now is large enough where we can partner and bill insurance, but I will tell you this, starting out small, I make it a cash-based business, and with the advent of technology and being able to swipe credit cards from your smartphone or people to send you PayPal or whatever it is, insurance companies, unfortunately, sometimes they can be a good thing because people will ask you, well, do you accept insurance? If I accepted insurance, I would be limited in what I could do for you.
Right.
But if you make a small investment in your health and wellness, I guarantee you that your investment will be tenfold the return
Right.
versus just kind of, I think we're in this insurance mentality, and that is kind of one of the conversations that we have to have with the clients that are cash based. Now, we do receive Medicaid dollars, but that's all funneled through state and regional agencies. So like if we partner with that organization that serves these individuals, think about like homeless shelters or facilities that kind of help advocate for people with developmental or physical disabilities.
Mhm.
They can actually bill Medicaid directly or get the state funding for it, and then we just invoice them for it. But honestly, insurance, everybody asks me about insurance, and I just have to be honest with you, it is awful.
Oh, I know. So I would think my pet, one of the things I've been supportive of for so many years is single payer, and I know Colorado is on the brink of incorporating single payer as a health delivery system as opposed to this horrible insurance
Right.
stuff that we're doing.
Well, think about this though, Kate. Think about, we've heard the term concierge medicine. So people actually paying like a monthly fee to a healthcare provider, i.e. a physician or a nurse
Yeah.
practitioner. But they get easy access to that healthcare provider, and they get stellar service. They pay a monthly fee, and you get your wellness checks. You get really low cost or maybe even free lab work. It's the same thing. It's concierge nursing,
Yes.
and you really just kind of have to sell the value to the client, because ultimately, once you're results oriented, we are evidence based practice. If we can
Mhm.
show them, prove to them that, look, if we just work together for like a month or two, I'm going to like decrease the time that it's going to take you to heal, just working together and collaborating
Wow.
with all the other healthcare providers, because they're telling, well, the doctor said this about the medication, but I don't really understand it, and this provider said this, and then the therapist said this. I don't understand. You can help them navigate it.
That is so cool. So that is an entrepreneurial opportunity.
Yes, and
Concierge
It
Nursing.
is concierge nursing, and what I refer to as the term is nurse consultant. And what does a consultant mean? It can be a very vacuous term. A consultant is
Uh-huh.
an expert. It's someone who has an expertise or a skill set that they can provide these types of services. So
Mhm.
I actually, I am CEO of my company, but I always introduce myself to my clients as a nurse consultant
Right.
because I'm an expert at what I'm doing for them.
And how do you go out and find the patients that are in need of your service?
Well, another, I think, pivotal question here that the budding entrepreneur needs to know is that going back to the hustle, you need to get out there and start reaching. Now, my brand, whether it's tied to my name, Kevin Ross, or Spire Health, or all the other things that I do, people
Uh-huh.
actually come to me now. So I can appreciate, as far as our marketing is concerned, we do very little marketing because it's all word of mouth. But I would encourage individuals to go network, go get into groups of people, go to like local rec centers or community centers with folks who might be retired or semi-retired, depending on the specialty that you want to work in. Here's another example. I have a great friend of mine. She is a lactation consultant.
Hmm.
And what she was finding was, okay, I can do this in the hospital, but what if I help moms that want to go back to work? So she was able to actually start there and get involved in these like new parent groups and mom and baby groups,
Absolutely.
and
Yeah.
then feed that idea, and then she now partners with corporations. And so these corporate entities hire her to come in to help them set up lactation rooms, to help them educate not only the moms, but also dads that are new dads, to kind of help support mom at home or to support themselves. Like maybe they need to, maybe there's a balance there. Like I'm a dad too. I've got 3 boys. Childcare health doesn't just happen with mom, it's the whole family. And so lactation consultants can do that, and they do that independently oftentimes.
Now, this lactation consultant that you were just referring to, did you help train her to do what she's doing? And yeah.
Well, no, no, and this is something that, so the lactation consultant is obviously there, that's a certification,
Well,
and,
I
and
mean,
that's and that's what
I don't
no,
mean
no, but to train her how to
yeah,
be an entrepreneur in a business.
yeah, yeah.
So I've met another friend of mine who is a lactation consultant. I did meet with her, and
Okay.
she and I were very close, and so she kind of like watched my business grow, and we talk. But this other lactation consultant had a little bit of business savvy, and I did meet with her, and she totally launched what it was. I'll tell you what it was. We had a mother who reached out to us who needed these services.
Yeah,
I'm not a lactation consultant, and I didn't have anybody on staff to do that.
right.
So what we did is we subcontracted with her to provide those services, and then we helped her launch, like branch out. And so obviously, to be a nurse consultant, you don't necessarily have to have all of this alphabet soup after your name. You don't have to have all of this extra education, but with lactation consulting, you do.
Exactly.
There are some
Yeah.
extra things. So there are things that you have to do extra, but to be a nurse consultant in a certain subspecialty, if you've got some bedside experience, that might be all you need.
I think so. Yeah. I mean, you've had a lot of person having a lot of experience with women. I mean, just raising children and breastfeeding yourself, you can just do so much with your patients that way. That's how a lot of people do well with it.
Right. Well, let me just share quickly how I tripped into another aspect of my business. So I told you I had 3 boys. Now they're in elementary school, but they had to be in daycare because I work full time as an entrepreneur and my wife works full time. So when I was actually looking at daycare centers and we were interviewing nannies, for the young one, and then daycare centers for the older two, um, what came to be was that I told him I was a nurse, and one of the women said to me, "Oh my gosh, we need a nurse." I'm like, "You need a nurse? What do you mean you need a nurse?" She said to me, and this was my first sort of inkling, like, "Oh my gosh, we could really branch out and provide the service." And so what happened was she told me that in the state of Colorado, and I think there are 32 other states in the United States, they require nurses to be involved, contracted with these daycare centers. And
Whoa.
so she was like, "Will you be our nurse?" And I'm like, "What do you mean? Do you need me to like be here?" She's like, "No. You just have to have a visit. We need to just have access to you if we have medication questions or talk about nutrition, or if we have kids with allergies or special needs, we need you as a resource. It's a state law. It's a regulation." I was like, "Perfect." Offered me a discounted rate on my tuition, And that was my first client in child care health consulting. And now we serve several schools and daycares.
Fascinating. Fascinating.
Head on the swivel. Just the opportunities are everywhere.
Yes. They're not obstacles, they're opportunities.
Exactly. There are.
So give us some more examples. This is very exciting. I know there's a lot of people sort of sitting on the edge of their seat on this whole topic.
Sure.
I can sense them out there.
Good. Well, like I said, whether they're with us live today or whether it's just going to be archived, it's just great. So some other opportunities, and I put this on innovativenurse.com, and I'll flesh this out for you today, is, Kate, we talked earlier about selling products. That's actually how I first started my entrepreneurial endeavor. Before I was a nurse, I sold products. I sold on eBay when eBay first started, and that's how I got kind of my entrepreneurial taste many, many years ago. And so as nurses, though, there are a lot of wellness products available out there, whether it be a skin care product or something that we, take in, ingest for us to feel better and for us to, help with symptoms or to really kind of elevate our immune systems.
Yes.
And as you know, personally, we can be really aligned. So like in my health and wellness consulting aspect of Spire Health Partners, we don't directly sell, but we have partners that come in. Like if somebody's interested in, say, a certain type of multivitamin or supplement that they can kind of get on the go that is, whether it be natural, organic, or aligned with their belief systems, we work with a lot of partners. They can come in and help them, and we make sure. Here's the beauty about being a nurse, is that you can look at the medications that they're currently taking. Because I don't suggest you going in like a naturopath and saying, okay, you got to get off all this, chew
Never. No.
Yeah, here, chew on this root and you'll be good. We can help the patients because these supplements they're alternatives and they can be healthy, but they can also be counterintuitive with medications that they're taking. So as a nurse, we can kind of help them, like make sure that you take this 2 hours after you take this. And you might have this side effect and so on and so forth. So you can sell products as nurses in your business. One of the things that we also I want to talk about, there are a lot of nurse bloggers out there. Now, some of you are like, yeah, I write, but I'm not really making any money. Well, here's the thing. Write really good content, be consistent, get your brand out there. I've got a branding and media agency outside of nursing, and we were hired because we were nurses. Mm-hmm. But because I was a nurse and because I was involved with nurses, they needed content creators that were nurses, that were RNs licensed to provide content to help them sell their services. And these were large organizations, and you can get paid to actually create content. And if you want to work from home, that's definitely something you can do, is write from home. And people think, no, that's not real. I kid you not, it is real, because we get hired out to do those things, to write those posts for them, almost like ghost writing. But they want our credentials, and they pay for those credentials too.
Oh, that's terrific. So can you give us, for those who might want to do that, a kind of what would be called a lead on where we could go to do that?
Well, where they're actually looking, where we get found out a lot is on LinkedIn. So I encourage all of those nurses to get their LinkedIn profile. And if some of you are like, what is LinkedIn? Then pause this podcast, go find out what LinkedIn is, and then turn the podcast back on. LinkedIn, you really need to kind of get your profile up there. Get your CV, get your experience up there. Put your titles, your initials, everything, all your credentials and stuff. And then just start producing content both on LinkedIn, on your blog. And here's the thing, these folks who wanted us came to us. We didn't go to them. And LinkedIn is actually where they were finding us, because it's a lot of what we call B2B, business to business.
Right.
Businesses a lot of them aren't nurses. Mm-hmm. They needed nurse writers to help them sell these products or services. They needed those credentials. And that
obviously, if that is what a person wants to do, as in terms of write the content, then they would put that up in their LinkedIn profile. I'm seeking this kind of outlet for my expertise.
And I know these writers. I mean, there's Renee Thompson of RT Connections. We worked together on a project, she and I and Keith Carlson, who's my co-host at RNFM Radio. Keith Carlson, he's another great example. He writes for several blog sites, and they pay him for that. Mm-hmm. I mean, they pay him. He gets to work from the comfort of his home.
Yes.
And so they are doing it.
Yeah, that's right. That's right. And are you an author, Kevin?
Well, you know what? I told my wife last night, and you know what, Kate? I haven't said this to anybody publicly. I am actually looking to actually do a book. I'm going to write and publish a book, hopefully in 2015. I don't have any books. I don't have any CDs. I have my podcasts. I have innovativenurse.com. I have the blogs. So I'm an author in that way. I'm a content
Right.
producer, content creator in that way. I don't
Exactly.
have any published books, but I figured, you know what? Maybe it's time to actually put a book together. And,
Well, you
I
can
think I'm going to take that
repurpose.
opportunity.
Yeah, you can repurpose the content that you have been putting out there for many years.
Exactly. And one thing that I wanted to remind everyone, so with rnfmradio.com, and that's our podcast, we've been doing that for 3 years. 95% of the audience are nurses. 90% of those nurses are entrepreneurs. We've been doing this for over 3 years. We have over 134 episodes, I think it is.
Hmm.
Most of them are entrepreneurs. And so, like for instance, I don't get anything out of this. So Barbara Dawsey, I was with her yesterday. Keith and I were interviewing her, and this is her new book, Nurse Coaching: Integrative Approaches for Health and Well-Being. Now, of course, if you're listening to the podcast, you're not seeing the book. But what I wanted to tell you is that, and I get nothing if you buy the book. I just wanted to promote Barbie because I was so inspired. She's
Right.
a nurse coach. She talks about integrative nurse coaching and health coaching because we hear about coaching. She's successful. And
And
she put together basically this textbook. This is a textbook. This is a resource. This is like kind of getting some education. This isn't just like a pamphlet. This is over 500 pages of information. When I got it in the mail, I was blown away. I was like, oh my
wow, what a
gosh,
resource for entrepreneurial activity.
blown away. So folks like Barbara Dawsey out there and myself and Keith Carlson and Linda Bart, like there's some pretty prolific names out there. Renee Thompson, Donna Cardillo, and Elizabeth Scala. We want to help you. We want you to be with us out in this entrepreneurial space. It's
Right.
fun.
Right. Right.
Yeah, it's fun. Speaking engagements. I mean, as you can tell, I love to talk. There are nurses that are getting hired to go speak,
Right.
and it's so much fun, kind of traveling the country and seeing these faces that we meet. We initially meet them on Twitter or Facebook, and we don't know them in real life until like we go to these conferences, and it's like a family reunion. But you can get paid to speak.
Hmm. Well, as an author, then, when you publish a book, I think that gives a huge amount of credibility, even beyond being a nurse. And people are looking to you to get out there and speak, and you get more expert status, and when you have written a book, and I think that's what not everybody can do that, but I highly recommend that you do it because I think it's a good idea.
I think it's easier than a lot of people think. My issue is time. And
Hmm.
even though I did a podcast recently on time management tips for entrepreneurs, I just need to carve out the time to do it. And I will. In 2015, I think that's kind of my thing that I want to do is kind of
Yeah.
get this book done. Because that's why people go to innovativenurse.com. And that's why I created it. I created Innovative Nurse and we created RNFM Radio because I'm out there doing stuff, Inspire Health. I said this earlier in the show. I want to share that. I
Hmm.
honestly, I thought authentic. I am sincere. I want to connect with you. I want to help. I want you to see I'm successful at doing this, and there are a lot of nurses doing this successfully, and you can too. And that's why we created these resources. It's kind of a jumping off point because you get inspired because we have interviewed some of the coolest nurses in the world, and they are
Yeah.
just awesome, ultra savvy nurses.
Right. Cool. And so it sounds like the RNFM radio is a tremendous resource for people who want to explore avenues of entrepreneurship.
Right. Our RNFM radio is actually going through some growing pains, but in a good way. We're about to launch a brand new network in 2015 for other nurse podcasters. And you think, well, wait a minute, there are nurse podcasters? Well, I'm with you today, Kate. You're a nurse podcaster.
That's right. That's
And
right.
so we want to showcase these nurses. We want to showcase this talent. And what we found in RNFM radio is that we can't hit all the avenues. We can't reach, we can't successfully, appease these appetites that everybody wants, like something like we have nurse writers on, and then just like full-blown entrepreneur like coaches. And we had a vocalist, a nurse who turned professional vocalist, Roxana, and she's amazing. And
Mhm.
but with RNFM radio, we feel like we can kind of pepper in a lot of variety, but we want to capture even more of that. And that's why I branched out to do the Innovative Nurse Show, because it's strictly about entrepreneurship and technology in your business, because that's what I do. And so that's going to be part of the new network. Keith's actually coming out with his show to be a career counselor, because that's what he actually does. But it's not just going to be Keith and myself. We've got some surprises in store. We've got some stuff in play. We're going to have some great nurse podcasters and authors on our network. It's going to be so much fun. I'm so excited about it.
Oh, that's tremendous! Congratulations. So,
Thank you.
what do you recommend in terms of a business plan for nurses? How would you recommend that they go about creating a business plan?
Well, business plans are quite funny. My company, so with Spire Health, when I tried to like do a business plan, there wasn't a template for it. There was nothing available for it because what I wanted to do was something that was really unique and new. Business plans are really tricky. I think business plans, so you can use go to like DocStock or go to like nolo.com or one of these online resources that provide some legal templates and contracts, and you can certainly fill in the blanks if you want. The thing with a business plan, and I try to differentiate this, if the reasons why you need a business plan would be one, well, does it help you kind of focus on your target audience and your target market and kind of keep you on track? But two, which I think is more important here from a financial aspect, is that if you need loans and you need to go to the bank, then you actually need a full-blown business plan. I think those two aren't used they shouldn't be necessarily used interchangeably. I think a business plan to kind of keep you on track and keep you focused on your target audience or your target market, I think that's totally different than you needing like funding. You need loans, you need money from banks, and that's a different type of business plan, and I don't want to confuse the two. To be honest, Kate, I did everything with Spire on the fly. I didn't have a business plan. I was so frustrated with it. I just did it on my own. I think what you need to do is kind of get granular, though, and make sure that you stay focused on your target audience and your market and make sure that you just kind of hone in on that. But again, there are some free resources, or at least cheaper resources to go to. LegalZoom's another one. Oftentimes you can find templates that you're looking for. You just fill in the blanks. And like I said, I think DocStock, I don't know if it's free, but there are some document places out there where you can just kind of fill in the blanks.
Yeah, I do believe you have to have a vision for where you want to go. And that would be true of almost everything that you undertake, you know. And then, from there, you figure out how to get there based on where you are right now.
Yes, because with any nursing assessment, right, like when we look at the patient, like we kind of draw out a plan of care. So let's look at it that way. Really kind of draw out a plan of care. You assess, like you kind of put your finger on the pulse of your budding business and how, what's the plan to kind of get you from out of that bed to vertical and out the door, as we do with our patients. And so I think we just need to look at it that way. And it keeps you accountable. That's what you need, is it keeps you accountable. And you go back to that business plan and you say, oh, wait, right. That's my target market. You can tweak things. You can pivot. You can re-strategize a little things. Like maybe that's not my target market. Maybe I wasn't as successful at this. Maybe I need to actually do this and tweak it just a little bit. But it at least gives you a visual.
Well, talk a little bit more about the target audience. I hear a lot about how we really need to have that clear before we almost do anything else.
Oh, of course. Because if you don't know who you're going after, who you're trying to connect with, then ultimately you can say you've got a business, but what service are you providing and to whom? And so here's the great thing is I was one of the first on Twitter, not the first. I mean, because there's so many people on Twitter, but it was so great. Like I started my company before, just as Twitter was getting started and just as social media was kind of really starting to ramp up. And so what you can actually do is it's great now. You can use search where people are actually talking about, I'm so frustrated with my doc here and I can't get my meds dialed in right, or I'm so, like, you can find like these forums and these groups and and it makes you think, like the light bulbs go off, like, oh my gosh, there's so many people complaining about the care that they're receiving or not receiving. And so that's kind of where you can dial in on your target audience, because again, my specialty at the time was cardiothoracic. It was cardiac, and now of course it's psych because we deal a lot with like mental and emotional wellness. But it was getting involved in these communities and these forums and just networking opportunities, like just going to a group and hanging out and just kind of overhearing conversations, and people are like, oh, you're a nurse? Oh, well, here, let me talk to you about this, because nurses. You could be in the grocery store and they're like, oh, I overheard you in a conversation that you're a nurse. What is this vitamin? What does this do? And you can almost, like, the target market almost comes to you. But I still think you need to decide where, what you're after, who you're after, and want to connect with. And that's part of the hustle. You got to get out in your communities. You got to branch out outside of your backyard. So virtually, again, using search, you can find people that might be into cardiac rehab or health and wellness, but they just don't know where to go.
Right.
But I was in so many meetings, so many gatherings, so many parties, so many whatever. Like if you have a spouse or a partner and you're at a Christmas party and people find out you're a nurse, they just start coming up to you and start saying, hey, listen, my doc gave me this medication, or I started feeling this symptom. You know, what do you think this? I know you're not trying to diagnose, but still, people are
Yeah.
interested in you.
Yes. Perfect. Kevin, do you have any parting words for us? And let's say parting advice for the nurses out there that are wanting to do something like what you're doing, or maybe coming up with a new idea for themselves or whatever. I think really going to your RNFM radio is a good resource for them to get some ideas too.
Well, I think the beauty about rnfmradio.com is that, and if you click on the guest sections, and we're still filling that, that's not even complete. But we have, I think what you can do is say, oh, I really align with what this person is doing. Mm-hmm. So you can actually maybe discover like, oh, wow, she is doing some really awesome stuff, and I wanted to do that. Well, you can do it too. There is plenty of room out here for us. So
absolutely.
First, you know, RNFM Radio is a great resource to feel like aligned with other nurses out there. The Innovative Nurse Show at innovativenurse.com is where I really talk about salient points of business and technology. Like I kind of get down to some nuts and bolts.
Right.
But to be honest, Kate, what we said, how we opened up the show, believe in yourself. Believe in the fact that nurses can do these things. Because nurses tell me like, well, you know, I can't. Like, I've got a license. Yeah, so does an accountant. So does an attorney. So does a plumber, an electrician. You don't have the electrician, you know, the electrical wiring isn't done by the plumber. The attorney is not putting in, you know, the toilet, or you work within your scope of practice. So no matter what level of nurse you are. So don't put those obstacles in front of yourself. Get real granular with you. Assess who you are. Assess your strengths. Don't be afraid to hustle, because there's going to be a lot of hustle, especially in the beginning. And look at your friendships. Look at your relationships, because sometimes you're going to have to go and say, honey, you know, I'm thinking about maybe stepping away from the bedside and kind of starting this endeavor, and you kind of need to get some feedback and say, you know, is this something that we can do? Is this something that you're willing to kind of be on this journey with me? You know, I've got a wife and 3 kids, and so it was a huge risk.
Yeah.
We did it together.
Mm-hmm. Also, getting out of your comfort zone, obviously, is huge.
Yes, because anybody who asks me, is there a playbook? Well, sure, there are plenty of resources. Find a consultant, find a coach, find an expert out there, but the playbook is always going to be rewritten and evolve. Your business will evolve. You will evolve, just like in any relationship. So the playbook is a great foundation, just like nursing school, but that's not where the real learning happens. The real learning happens is when you get the skin in the game.
Right. Perfect.
Sure.
Thank you so much. I really appreciate this.
No, it's totally my pleasure, Kate. And like I said, if we had all day to spend with each other, I could certainly rattle off another 20 opportunities for nurses out there. So I don't want people to think that there's any limit. Again, the only limit is what you put on it.
Absolutely.
There are so many opportunities. People, if you don't feel valued at work, trust me, I walk into rooms day after day where people look at me as a nurse and they value my opinion. They're actually hanging on every word I say, and that is a great feeling that they trust me that much. It's awesome.
Oh, I agree. I feel that as a nurse, I've been a nurse for 3 decades and have had a lot of respect because of it.
Yeah, and that's great. And if you're burnt out, or you just kind of feel trashed at work, or people aren't listening to you, or you feel devalued and disempowered, then that's a point where, as an entrepreneur, you can start feeling self-empowered again and important, and people listen to you and respect you.
Yeah. So I just want to close by saying one thing, and that is that I am offering a 2015 vision statement for your optimal health for the people who are listening, and I want to help you achieve the optimal health of your dreams. So I guess the best way to contact me is katelevingshank.com/contact, and we can get together, and I want you to discover for yourself what it is you want for your health, and I can help you do that. So, Kevin, thank you again. It's been lovely talking. We can do this again, too, because I'd love to hear you rattle off the other entrepreneurial opportunities that you just referenced.
I would love to, Kate. I would love to. Just tell, everybody head over to innovativenurse.com to find out more. Kevin at Innovative Nurse. and Kevin at innovativenurse.com, and just hit me up at Innovative Nurse, or just Google Kevin Ross RN BSN.
Yeah, it comes
I'm
right
there.
up.
I'm on Google. I'm there. So anyway, it's been a pleasure, Kate, and I look forward to being with you again.
2015 is going to be a really rocking year, right?
Let's rock it out together, Kate. I would love that.
Thank you. Thank you.